Thank you so much, Megan, for that just incredibly informative and fascinating presentation. One of the themes that came through from our previous presentation was the importance of being kind to yourself and looking after your own health and well-being. So clearly sleep is just a huge part of that as well, isn't it? Yeah, so I think we could all do with improvements in that regard. I'm inviting everybody, please ask any questions via the chat function, which is now open. We've had one come through from a patient who has been diagnosed with sleep apnea and has a CPAP therapy machine. Is that something that is usually with them for the rest of their life, or is it something that they can improve their natural sleep pattern? They may be able to not have that anymore. Is that something you can answer?
Sure. Well, it depends on the individual and the things that are driving their sleep apnea. So many things can contribute to sleep apnea. Some of them are things that we can change, and some of them are things that we can't. One of the bigger drivers outside Fabry's disease is weight gain. So if people are able to, if they do have excess weight and they're able to reduce that, I've certainly had a number of patients who've managed to get completely away from their CPAP device and have sleep without any sleep apnea if they've lost enough weight. But that's obviously much easier said than done. And most of us tend to gain a little bit of weight over time, but that's probably one of the bigger modifiable factors. Improving your general muscle tone and fitness actually improves the muscles of your throat and your diaphragm, and you can actually improve the way that you breathe at night time. There've been a few incredibly tiny studies of people who've had used musical instruments where they've actually trained their muscles, including using the didgeridoo, is one Australian study, and reduced the severity of sleep apnea sort of by building up muscles. But again, muscle tone is usually something that slightly worsens over age. The other two things that are probably most relevant to Fabry's disease is if you had some fluid retention related to renal disease, having that, really well in check. So following what your nephrologist is recommending about your dry weight and fluid restriction, if that's required for you, would minimise sleep apnea. And then the other thing that we don't fully understand but looks quite promising is that enzyme therapy might reduce some of the drivers. So it's not necessary that people would need sleep apnea all of their life. It does happen that most of our patients do end up needing CPAP therapy for most of their life, but we have had some cases of people who've been able to reduce it and get off it. I guess, the upside about CPAP therapy is it is just air. So it's not like having to have a tablet for the rest of your life. There's no long-term side effects from it. It's a bit annoying as a device, but I have had many patients who've got sick of wearing the device and thought they'd have a time off it, but found that their sleep was so poor without it that they've been happy to go back on it.
It's interesting you talk about the fluid as being one mechanism, and especially when you talk about things like restless legs. Like I know personally, at the end of the day, I sit on my exercise bike for 10 minutes. And I'm certainly not working hard, but just ticking over, and I feel like it's almost just a lymphatic drainage fluid movement mechanism that I find then that evening I'll sleep better with less restless legs. So it's just interesting that that's a proposed mechanism, that's something I've personally experienced as well. The days that I'm on my bike, I tend to sleep better. So
exercise helps us in many, many ways to get a better night's sleep, and we think that's probably one of them. And indeed, this is not in Fabry's studies, but in other studies of patients who have restless legs, quite often just getting up and walking on a cold, hard surface like a tiled floor in bare feet gives your body some quite robust sort of electrophysiological feedback and actually reduces restless legs. So if you find that you're twitching and having difficulty getting off to sleep, that's something very simple that's worked for a lot of people, sort of getting out and walking on a cold, hard floor.
And then you mentioned in the morning that having that moderate exercise in the morning in the sunshine, that helps your sleep patterns. For patients with Fabry disease that have difficulty exercising, is just like quite gentle exercise still, I'm assuming that's still better than nothing, isn't it?
Yes, yes. Any sort of movement that happens, particularly if it happens outdoors in the fresh air, it will improve your night's sleep. So it helps to set your body clock. So your body clock is knowing that this is the awake time, and then the converse happens at the other end of the night, that you secrete more melatonin if you've had good daylight exposure in the morning. And also you just feel more tired, and your body's been used the way it needs to, and all those triggers for the body to get a good night's sleep are there if you have some regular exercise. So, you don't need to run a marathon any day by any means, but, a reasonable amount of activity, anything better than you did yesterday is probably good.
And we've had a question here about melatonin. Is there any other ways to receive that from from food, or is it just from outdoor activity? Do you want to just talk a bit about melatonin?
Sure. So I personally think the best melatonin is one your own brain secretes for you. So, acquiring it the natural ways is probably best, but there is synthetic melatonin widely available. So you can find that in health food stores. And there is one that's available on prescription, a long-acting melatonin called Circadin. And many people have found substantive benefit in taking that as a tablet half an hour before you go to sleep.
But not found in food necessarily.
So we think there's some foods that have sort of help you to synthesize the melatonin, but those studies are not really strong proven to the other end, if you know what I mean. So people changing their diet, we haven't got strong data. But a healthy diet full of, fruit and vegetables does improve synthetic function of all proteins, and melatonin is one of those.
Best thing to do is to get out in the sunshine.
I think so.
Yeah. There's a comment here from a patient. I have sleep apnea, but they find their legs actually twitch. Their leg twitching increases using the CPAP. Is that a expected mechanism? We'll just take that as a comment.
Yeah, so we see huge variation. I don't know that the two would necessarily be linked, and not necessarily in a bad way. It might just be that the person using the CPAP is actually sleeping more deeply, so actually getting more consistent joined up sleep, and then that's sort of bringing out the leg twitches. You'd have to sort of take it as a case-by-case basis. When we do a diagnostic sleep study in the laboratory, we can see the relationship between the timing of apneas, leg movements, and awakenings. And so that's probably the best way for us to see which is driving which.
We've got a comment here from Dr. Andrew Talbot of Royal Melbourne Hospital, who was authored the study that you mentioned that you talked to. He notes that Fabry men available at the time at the Royal Melbourne Hospital, they actually recruited all the men to do the study, and they kindly did. It meant almost 50% of Fabry men were affected. Of note, their body mass indexes were all less than 30. So it seems like from that mechanism that actually obesity wasn't necessarily a factor, but then there is this higher rate of sleep apnea in Fabry patients. What I also find interesting is when we've done studies of our own membership, we also have a higher rate of anxiety and depression amongst our Fabry patients. Do you know what I mean? And it'd be interesting to see whether there's actually a correlation between the two as well. Yeah.
Yes, they're difficult studies to conduct, really, because having any sort of chronic disease that requires a lot of attention is not surprisingly associated with some mood disturbance. You might feel a bit more anxious about things. But yes, by all means, I think, poor quality sleep might be part of it. So it'd be great if we could do some more detailed studies over longer periods of time.
It just becomes a bit of a cycle, doesn't it? And then if, I suppose, anywhere you can make a gain, that helps that overall. And the other thing I thought it might be interesting to talk about was how your sleep, or particularly poor sleep, can then affect your pain management. Have there been studies into pain management, because Fabry patients are chronic pain sufferers?
Dr. Talbot might be able to jump in here, but I'm not aware of any pain and sleep and Fabry's studies that have looked at all three together. But certainly with people with chronic pain syndromes do tend to sleep worse. And when they sleep worse, the chronic pain manifests more severely. So, and when we have been able to improve people's sleep. For people who've got chronic pain, they've often been able to reduce their pain relieving medications. It's a very complex equation because many of the pain relieving medications can interfere with the chemical cycling that's required for healthy sleep. So it's a difficult problem to untangle, but certainly the association is there, and we think improving sleep any way we can should improve people's experience of pain or minimise their experience of pain.
So what would be the next step for anyone who might be watching who is wondering if they may have sleep apnea? Where would they start?
Sure. Well, look, sleep apnea is very common. It's particularly common in our community. And probably the first thing is to ask people around you, do I snore? Have you ever heard me stop breathing at nighttime? There's sort of two things that often go along with sleep apnea. And then the next step would be to approach one of your doctors, and a general practitioner would be very well placed to deal with this. Sleep apnea is a very common condition in our community. As I said, we think up to 10% of Australians have it. So most general practitioners would have a referral mechanism to someone to organise a diagnostic sleep study for you. There's lots of different sorts of diagnostic sleep studies. There's limited ones that you can do in your home, where when I say limited, we're limited in the number of data channels that we're able to acquire. Personally, I think the sleep studies that we conduct in our laboratory are a little more detailed and probably slightly better for patients with Fabry's disease, because you get to measure the leg movements and a few other components. But certainly a sleep study would be the first place to go, and then having a consultation with a sleep physician after that to interpret your sleep study in the context of your medical conditions and give you a tailored approach to what to do next. But they are widely available treatments. Widely available investigations.
And something that I've heard a few dentists starting to recommend, as far as you talked about the guards that you were talking about.
Yeah, so look, there's a number, and they're growing all the time, of medical dental devices. Effectively, all of them bring the lower jaw forward relative to the top jaw. So the tongue is attached to the lower jaw. So just by bringing that lower jaw forward, you sort of move the tongue forward and open up that space at the back of the throat. It doesn't really help you with the muscle tone in the throat, but often the tongue is the main driver of obstructive sleep apnea. So having that moved forward can help. They're quite complex pieces of orthodontics. So usually the simplest one will be a double mouth guard. That's sort of one on the top side and one on the bottom side, and then some sort of attachment between the two to bring the bottom jaw forward. So you're sleeping with a device inside your mouth. I guess one of the downsides of it is they're relatively expensive to manufacture, and they have to be fitted to your own teeth. So there's less, usually not a possibility to try before you buy. So certainly it's definitely an option, particularly an option if people don't want to use CPAP therapy, but probably the best place to start is to work out exactly what you've got, what's driving your poor sleep, with a diagnostic sleep study, and then embark on different treatment approaches.
Wonderful. If there's no further questions, we're coming to the end of our session. Thank you so much for joining us this afternoon and for your sharing your expertise and your knowledge with us. It's been lots of food for thought. And I think there's just some simple strategies that we can all work on even prior to diagnosis, just about improving our sleep just across the board.
Yes, even without sleep apnea, I think there's a lot we can all do.
That's something, I think, to reflect whether we all actually get that 7 to 9 hours. Yeah, so yeah, thank you so much. It's wonderful. Yeah.
No problem. Well, thank you very much for inviting me. It's a great community that you have. Thank you.
Wonderful. Thanks, everyone. We'll have moving on to our next presentation shortly.